Dr. Yamini. Her qualifications are a PhD in reproductive medicine, Masters in clinical embryology, and she also has done an MBA in hospital and healthcare management. Academics, she's the lab coordinator and mentor. She has done FNB reproductive medicine and IRM, Triple M fellowship, and she has also done an embryology and andrology teaching program at IRM, and she has also been an external examiner for postgraduate diploma in SRM University. She is certified by ESHRE in 2022, and she has done multiple peer-reviewed articles in JAR, IJAR and IJBT. Okay. Published over 20 articles in index journals, invited faculty for national and international conferences, and she is a member of ISAR, IFS, ACE, MACE, ESHRE, and her field of interest is cryobiology and embryology. Congratulations on your ESHRE certification.
Thank you so much.
Welcome.
Thank you for that elaborate description. And before I would like to start, I would like to thank the FOGCE team for giving me this opportunity. Today my talk, unlike before, always I've never done this topic, it's my first time. It's about the regulatory documentation standards for IVF lab. So basically it's going to be about what consent forms I'm going to use in my lab for what procedures. So this is going to be an extremely dry topic. I've tried to make it more usable because every time we talk about documentation, the first question that comes to all the minds is, why is it that as an embryologist, I am taking care of documentation? What we don't understand is it is very important that we have also responsibility to make sure that the documentations are kept right and signed by the patient and the consultant. Otherwise, if there is any problem, you will be behind the bars along with your consultant. So, first slide is just the topic of discussion. It's going to be about the certificates required for my level 1 and level 2 clinic, the documentations for my third party reproduction, documentations required for an embryology lab, and the ART bank requisites. Unlike before ART bill, now the certification and the documents are very important. We have people coming in and checking if we are doing the right amount of documents and right amount of clinical requirements. So as we all know by now, if we are practicing, it is very important that we have our certificate given by the ART bill to be a functioning level 1 clinic, a level 2 clinic, or an ART bank or a surrogacy clinic. And apart from that, we also need the PCPNDT certification. This is because every center that we know uses a scan mission for an oocyte pickup or a follicle stimulation study. So it is very important that we have a PCPNDT intact also. And it's very important that we make sure that both the certificates are valid. So as soon as the patient comes inside our lab, the first thing that we do is our consultant sees the patient, tries and clerks the patient, and the first initial test that is given to them is your semen analysis test. So in our center, in the entire presentation, I'm going to be presenting what are the documents that we use in our center. It's going to be completely basic. There are a lot of adjoining consents that have come newly, but this is the basic primary one that is required. So for a semen analysis, it's very important that we have the serology report in hand because we have to know they're serology positive or negative before processing the sample. The next is your ID proof and your passport size photograph. Why? Because we have to make sure that the patient who's coming to us is the same as mentioned in our file. The next thing is a duplicate copy of every report must be maintained. And this is the copy of what we use in our institute. In case the patient is not able to collect the sample, there is also one consent form that has come up which is called as your home collection consent form. Because a person who's collecting the sample at home, we should also make sure that the person is giving us consent that this is my sample, I'm depositing over here for the procedures that is to be forthcome. So I also make sure that I collect the ID proof in the passport to make sure that I don't get myself into any kind of trouble with mismatch. As soon as the sample is collected, either it is put through, if it's going to be a level 1 clinic, the sample is put through semen analysis or an IUI procedure. So this is the IUI consent that we have. The content over here is very well mentioned in the ART bill. So all of you can go back to the ART bill, understand what exactly it says. The most important line that is to be involved inside your consent form is that the sample is used as the husband or the donor. This is your donor consent form which will have indications about which is the source of your donor, what is the type of your donor. So it is also very important that we make sure along with the donor consent form, we have two other forms that is attached. One is the form that you get from your ART bank. I'm telling all of this because all of you must check all of these forms before you keep a tube or a sample for processing. So this form is given by your ART bank which will explain about the requisites or indications of the sample because if, based on the couple's blood group, the height, the color, we have to select the sample that is required. Along with it, we also have to give a letter to the bank from which you're purchasing the sample saying this is the sample number that I need, these are the indications, and I'm using it for this purpose on this date. And it must be signed by us and the consultant along with the patient's signature. So once you use the sample either for a normal IUI or a donor sample IUI, you have to make sure that the report has complete data about it. Because we are a research institute, we also have all the data including the follicle size, days of stimulation, so that we can retrospectively go back to it and analyze what is the outcome of it, and we can have a paper or an article out of it. So this is our insemination report that we use. Sometimes the patient requires 2 IUIs in the same cycle, so we also have included the requirements of both the cycles. So once the IUI procedure is done, if it's going to be in few level 1 centers, there is also semen freezing that is included. So for that, we have a very specific semen freezing consent form. Suppose we are freezing the sample that is given by the husband for either ART backup or for fertility preservation. It is very important that the boxes that is mentioned over here are ticked. These boxes mention what it is that we should do with the sample if the patient is dead because of foreseen reasons. So we have to be very sure that the boxes are ticked, and only to the ticked boxes the sample must be handed over. For example, we did have a patient who came to us after several years, and he had his sample frozen for fertility preservation. So when he froze the sample, he was unmarried, but when the person came back to collect the sample, it was his wife. So in the consent form, it was mentioned that the sample has to be handed over to the mother or the parent. But the wife came back to us claiming for the sample. So we are in a very difficult predicament, and we couldn't give the sample to the wife because it was very strictly mentioned that the sample had to be handed over to the parents, and they will decide what has to be done. So to make sure that we don't get into all of the trouble, make sure you have this consent form with all of it ticked accordingly. So in case the sample is coming for any reason, we make sure that the sample quality is mentioned in our report as well. So for some patients who come for fertility preservation, we take up till 3 to 4 samples, and that is why we have multiple columns over here where we freeze more than 1 allocates. If it's for ART backup, maximum of 1 or 2 based on what is their requirement for freezing. So the first thing that I always see is the serology report, because it's very important for the lab and for us. Next is the ID proof, your photograph, and the consent form of the semen sample must also have a duplicate, which will be with us. So once all of this is done, in our center, we also have a DFI test. Our DFI test is not like we have the test done and the report is given. It is extremely detailed because we have a sheet which confirms this is the quality of your DNA, this is the semen analysis. It helps us for our research purposes. So the first question will come, if you are taking the data from DFI, are you getting the patient signed for using this data? So it is very important that you have a declaration, self-declaration, and your indications, your patient medical history also to be written, so that it can be helpful for us to identify the cause and to relay it to our consultant so that they can act accordingly. So once it is signed, only then the data of the DFI can be used. And the report is given to the patient as per our hospital regulations, where the DFI percentage is mentioned and given to them. So these are pretty much the consent forms and the record forms that are used in a level 1 ART clinic apart from your QC forms. So when we go to a level 1 clinic, in a level 2 clinic, we have implemented what is called as a checklist for all our procedures, because after the ART bill, we have umpteen number of consent forms to take care of and to make sure that they are all kept in order. So this is a checklist for a simple IVF. If a patient comes in for an IVF, what are the things that we'll have to see if they have signed and if it is kept in your file. So this is pretty much, we have around 23 to 25 documents that is mandatory, and apart from it, there is an adjoining consent form which adds every month or every week based on what are the changes that are made. So this is the checklist that we use for the recipient. For oocyte, recipient and donor, it is 2 different checklists with 2 different requirements. And the next is checklist for the oocyte donor. Unlike your other 2 checklists, this one has one separate list of documents that your ART bank should be giving you. We have to make sure the entire set of documents is collected from them before we bulge into the procedures, because the documents give us an overall view of what is the quality of the patient, what is the number of eggs that you can expect from the patient, and also it is very important that you collect the Aadhaar number. So after this documents is collected, only then the patient is put through your hospital documentation and then your other documentations. So I'm just going to explain briefly the different ones that are mentioned in the checklist. As soon as the patient comes to us, the junior embryologist or the junior consultant is the one who sees the clerking. So what we do over here is we see if the male partner and the female partner have the following documents. This is just for the initial clerking and for initial analysis. Once the male and the female partner is entirely put through all of the required tests, the next is the financial counseling form, because we do face patients who come to us in middle of the treatment and say, madam, engita kaase illa, idukapra enga treatment vena nirthirunga. So we have to make sure that we tell the patient what is the financial burden or the financial allocation that they have to make before starting the procedure. So we also have a financial counseling form, and they are explained to the patient saying this is the amount that you must be ready for in the future. After that, we have an information checklist. Because we are a very huge department where we have fellows along with us, we have other consultants, junior consultants, senior consultants. We make sure there is an information checklist put in place, which says this is the procedure that is done. These are the general instructions of protocol. This is what we will be doing in the protocol, and this will be the after effects or the effects of your procedures. So this information checklist is given to all the patients after explaining. So we are sure that whatever is mentioned as a bulletin and information sheets are explained to the patients as well. Next is the counseling form. We also have a counselor who counsels about the welfare of the child and for the patients also. So once the initial consent forms are signed, then we go into the ones that must be signed by the couple and which is also mentioned in your ART bill. So the first will be the consent form to be signed by the couple, by both the women and the man, because they will be explaining that in this procedure all the oocytes that are collected, what is going to be the effect on them, what is going to be the quality of the sample, what is it that we're expecting from this procedure. All of it is explained to the couple, and this is in the exact format as mentioned in your ART bill. So once this is signed, then the patient is put through your oocyte retrieval. So you have a very specific oocyte retrieval form that is given by the bill, and that has to be incorporated for this procedure, be it your donor egg collection or your self egg collection. After you collect your oocytes, what you do, you take it to your lab, do your ICSI, and you bring them back for the most important procedure, which is your embryo transfer. So this embryo transfer form is as important as your egg collection form. Why? Because this is the form that gives you boxes where you have to mention if you're using the self oocyte or your donor oocyte, your self sperm or your donor sperm. It also mentions how many were collected, out of that how many were embryos and how many were frozen. So all of this is mentioned by us embryologists, because the consultant will not know how many were the embryos that are formed from the oocyte. So it is our responsibility to make sure that we write the details into it. For donor sperm and donor oocyte, there are separate consent forms given. For donor oocyte, this is kept along with the forms that is given by the ART bank. This one is not given by the bank. This is something that you have to take. The content of it I'm not explaining much because it is the same as given in the ART bill. So you can go back to it and check and then bring your own forms into your centers. For donor semen, as I mentioned previously, it's the same protocol where you have to have the consent form, you have to have your donor checklist and your letter to your donor bank. After these things are done, the first thing that we make sure it is signed is the acknowledgement form, because always our patients, when they go back to the consultants, they will say there is a chance to say we were not informed by the embryologist how many embryos were there, how many they have frozen, even though we have done it. So we have put into a form in place which says we are explaining all of this to the patient. This is the number of oocytes collected, this is the number of mature eggs, the quality of eggs, the nature of the sample used, and the date of embryo freezing. So this also gives us a proof saying that no, my embryologist has explained to you, we have this acknowledgement form, you have signed over here. So it has been very well explained to you about what was the nature of the procedure. So once this is explained, the patient comes back to us on day 3 or day 5 based on the center's requirement for embryo freezing. So embryo freezing, be it your embryo, gamete, your oocyte or your sperm, all of it have to be intact, and also it's very important that we mention what exactly we are going to do with the oocyte or the embryo after. I'll just take a couple of more minutes, so sorry. What is it that we are going to do after the procedure of embryo transfer is done? If the patient is going to turn positive with pregnancy, what is it that we are going to do with the extra embryos is very important, because all of us have this in mind. The patient has done a ICSI procedure, the transfer is done, she's fallen pregnant, she's not coming back to us for the next 2 years, 3 years, not renewing also. What will I do with the rest of the embryos that is present? So for that, we have a consent form in place in our institute which says this is the amount that you have to pay for these many embryos, and you have to come back to us within 1 year. If you do not come back to us within 1 year, or you change your address and contact number and you do not inform to us, we will be forced to discard the embryos without prior notice. So this is the form that we give to them, get it signed from them, so that we are not in trouble tomorrow and we don't have to keep pouring liquid nitrogen for embryos that have not been renewed at all. So in spite of giving this form, we still have patients who do not turn up to us. So what is it that we do to them? We have a self-declaration form and we have a protocol of discarding these embryos or oocytes that we have. First thing that we do is we call them and tell them the embryos are available. So please come back to do a renewal or discard it. We send them a message. After that, we send them a mail with self-declaration that is shown over here. The self-declaration will have 3 options. The first option will say, I am coming back for the transfer. The second option will say, you please discard the embryos. And the third option will say, we will be coming back and we will not do the renewal charges and keep the embryos but not for transfer. So these 3 options are given to the patient. Still, we have patients who don't come back to us to tell us what exactly to do with the embryos. So what is it that we do that time? We directly go in for putting a public notice on the newspapers in a local language and in English, which will say from this year to this year, whoever has had the gamete frozen with M, please come back, renew it, or else we are discarding. So once the public notice is given, we make sure that these embryos, after 15 days from the publication, it is discarded directly. So doing all of this, we still have proof. So we also have the patient comes back to us and says we had no choice, we couldn't communicate to you. Now we have the proof saying we called you, we sent you a message, we mailed you, we put a public notice but no reply, so we discarded. So we are safeguard in this case. Next, a couple of documents about consent of surrogacy. Because of the lack of time, I'm not explaining much about it, but the content is already there in your ART bill, you can go to it. So it pretty much says what is the information that has to be taken from the intending couple and from the surrogate, which will include the basic information of the father, the mother and the surrogate. And also we will, as centers, we will have to give that psychologically the mother, the surrogate is of good mental health for proceeding for use for the cycle. The next thing that is very important when you come to the embryology lab is the embryos and oocytes and sperm are present over here. So it's very important that we have the quality check cards kept intact. So these quality cards are what we use in our lab, which pretty much talks about what we check every day, what we check in incubators, laminar flows and other instruments. And we have a very detailed embryology record which has full data about how much was the AMH, how much was the P4, E2, how many follicles were expected, what was the stimulation, days of stimulation, and also we have details such as what is the cause of infertility. And only after writing all of that, we will write what is the number of oocyte collected, what was the embryo formed and frozen. This is very important as embryologists for us because we need to have this kind of a record to go back and analyze what was your way of doing also. For self-improvement and for institute's improvement, it is very important that we have all of this in place. In case the patient comes to us for PISA or TISA, there is a specific consent form that has to be signed because not all procedures of your surgically retrieved sperm will have sperm available in it. So it is very important that the patient should tell us what should we do with the oocyte that is collected in case there is no sperm on the day of ICSI. So the very recent one which is up for a lot of discussion is the last few slides. This is about the shifting of embryos and oocytes. So what do we do? So there is an application that is given by the ART bill which says what exactly must be written on your application for shifting of embryos and also for your use of embryos. It's very simple. Now the patient themselves have to go, they have to submit it online and they will get the proceedings from there online. So it is not about the clinic that is giving the gamete or receiving the gamete. So I'm just going to end with the key features of the bill. What does the bill says? Bill says what are the procedures that must be done in the different clinics and different centers. The registration of ART clinic and bank is very important before we start the procedure. It also mentions the eligibility criteria for the commissioning parties and for the donor parties. It offers services. It tells about the services that should be offered in a center and also the right of the child born through ART, which should be very much vigilantly watched. And also the duties of the ART clinic and bank and also the offences and penalties. Offences and penalties is something that we always have to have in mind to make sure that we as embryologists work ethically and work in the right way to make sure that our patient fall pregnant with the right number of oocytes. So I would like to thank FOGCE for giving me this opportunity. Starting for the support and guidance, I want to start Dr. Kundavi, my HOD, my IRM team, Swami sir for constant guidance, and also for Rajesh sir who's always been there to help and to support. Thank you.